This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. It is the largest organ in the human body and one that you cannot live without. The liver is responsible for storing and filtering the blood and secretion of bile.
Anything you eat, anything you take, medicine, whether it's prescribed or unprescribed, or any simple vitamins, actually all gets filtered in the liver. And it's it has both a metabolic excretory function.
The parents of 3-year-old Waki realized this early on when their little one was diagnosed with biliary atresia, a congenital disease that causes massive damage to the liver, allowing it to rot.
Kasi na-diagnose siya, mag-4 months na. Before kasi, yung paglabas niya sa akin, after a few weeks, nanilaw siya. So, dinala namin siya doon sa unang pedya niya. Sabi, blood incompatibility lang. So, sabi niya sa amin, ibilad sa araw para umayos yung paninilaw. So, binilad naman namin. So, all the while, akala naman namin okay na. After a few months, yung color ng pupo niya, naglighten, yung almost oatmeal na yung color. After a few months pa, sinabi nung pinsan niya na pedya rin na something's wrong. Tapos yun nga, doon na niya na-diagnose after nung liver biopsy na biliary atresia yung sakit ng bata. We decided na to push through na ako na lang muna yung mag-screen para maging donor. So, after siguro mga 4 days, okay na lahat ng lab results naming dalawa ni Joaquin. The following Tuesday, na-schedule na yung transplant namin.
Waki had to endure a 12-hour operation to treat his ailing common bile duct in Taiwan.
Siyempre, pwede kasi dalawa sila eh. It's either worst case, dalawa sila mawala. Then, pwedeng isa mawala. So yun, ang hirap. Then may anak pa kami na iwan sa Philippines, so ano mangyayari kung kami dalawa lang? So, kailangan ko ng pray during that time.
While Waki has slowly but surely recovered, most people who suffer from various diseases such as liver cancer, hepatitis, and cirrhosis fail to recognize the warning signs until it's too late. What are the common causes of liver diseases? What are some early signs and symptoms? What treatments are available? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Benjamin Gerardo Perez, gastroenterology consultant from the St. Luke's Medical Center, Quezon City, and the UST Hospital. Also with us is Dr. Benjamin Benitez, also a gastroenterology consultant from the Makati Medical Center. You may call us at 548-4678 if you have any questions for our esteemed doctors. Good evening, doctors. Welcome to the show.
Good evening,
Doc
Angel.
Benj 1 and Doc Bench 2. Tonight we're talking about the liver, how to care for our liver and how to make sure that it is healthy and functioning well. So our first question is, what is the liver's function in our body? Doc Bench 1.
Well, the liver has a lot of functions in the body. It has multiple roles. It detoxifies toxins and waste products from our blood. It produces the proteins that we need in our blood in other areas. It produces including blood clotting factors. It also helps in the digestion and the processing of our digested foods, fats, and sugars. Mm-hmm. So it has a lot of roles that is important in our body. So it's a very vital organ, which almost we cannot do without.
Mm-hmm. And because we cannot do without this, we manifest signs and symptoms of being healthy because of how the liver is functioning in our body. So how do we know that our liver is healthy and functioning well? Doc Benj too.
Well, there's just so many signs and symptoms to look out for. The more common thing that mostly people will look for associate liver function would be hepatitis, which is the most common thing we have here. Normally, they equate jaundice, so yung paninilao, as a form of liver ailment. Or when patients would have a contracted liver, when their liver had shrunken from taking too much alcohol. Normally, they have associated this with liver ailment. The extreme of this would be liver cancer when there is already further progression with liver disease, wherein the endpoint would be liver cancer.
You mentioned jaundice. Let's go
Correct.
to our case study, Waki, who was diagnosed at 4 months old. What can you say about his case, Doctor?
Well, his case is a congenital problem because there was not a good development of his bile ducts, which would transport the bile, which helps dissolve our fatty foods from the liver to the gallbladder. Because of this, the bile goes into the blood, and this causes the jaundice. So the jaundice is caused by the bile being present in the blood, and that's a very common symptom when you have a problem in the liver in this kind of situation.
So the mom mentioned that they caught it after a few weeks of her giving birth. Is there like a time frame for which to catch it early on, earlier than what
Usually,
you
most infants
mentioned?
would have a time wherein they are normally so-called hyperbilirubinemia, wherein they can be jaundiced for a short period of time, but it cannot extend more than a certain period. Now, in the case of Huaki, most of the time this happens in an infant during an infancy, and I think they caught him early. I think they said 4 months.
Yes, Doc.
And the golden time for surgery for biliary atresia is around 3 months, basically, to do what I think was a Kasai procedure for the correction of the biliary tract. No? It's creating a tract between the liver and the intestine. Actually, that is the one that is obliterated. Basically, the bridge between your liver and the intestine is usually obliterated. That's why there is no flow from the liver to the intestine. Thereby, the function or the digestive function is also impaired. So you do not absorb the necessary nutrients. So usually the baby is jaundiced, they fail to thrive, they're weaker, they don't have good appetite and all that stuff. So basically, that is the reason probably the mother saw that in her baby. So that's why they consulted the pediatrician.
And they went on to having that transplant done.
And not transplant, and probably it's a shunting procedure, but normally if that fails, the recommendation actually is to have a transplant around in 3 years, in age 3. Normally they allow the patient to grow a little bit older, and that is usually the case. No? But normally it should be done within the first 3 months.
3 months. So, well, we can go back to the case study and we'll find out more about the liver function. But first, we have a phoned-in question from Mara Jose. Hi, Mara.
Hi, Miss Angel. Good
Hi.
evening.
Good evening. May question ka for our doctors?
Yes, may question po ako. So, bali, Doc, nung nag-college po kasi ako, natuto akong kumain ng street food. Before that, my parents would always warn me na masama yan, magkakasakit daw ako. Kami nung friends ko nung college, nahilig kami sa isaw, yung mga barbecue, yung Betamax, yung iba-iba klase po talaga. So, totoo po ba na nakakasama sa liver yung pagkain ng sobrang street food?
Thank you, Mara, for your question. Doctors?
Well, yung pinaka-problema if you're eating street food in relation to the liver is pwede kang magkaroon ng hepatitis A. If yung street food na kinakain mo is infected with the hepatitis A. So that's the danger because yung mga street foods, it might be infected and there can be many causes of diseases. You can get it, and one of them would be hepatitis A. Kaya yun ang nakakasama sa liver.
And eating too much street food, Doc, or yung once in a while, okay lang ba yun? It
I
won't
don't
give
think
us
so.
hepatitis A.
I think
In general.
UPPGH has I stumbled into that journal where they have published a journal before when they studied street food. Per se, the street food is not a problem, but actually it's the processing of the street food. So I think the bottom line of the paper was they're not clean enough. That's why so bacteria still resides. Remember, like ESA, these are intestines. So basically, the intestines would contain some bacteria. It's not actually in relation to the liver only, but the overall health of the person taking it in, because you can have salmonella, you can get typhoid from taking that.
Even if it's cooked, diba? You can see it cooking
Because
in front of you.
Oh, okay. If it's cooked, that's fine. But actually, when the study says that when the downtime, when the temperature drops, normally for most food establishments, 60 degrees is actually the temperature they're looking for. That's why you can just put hot water at the bottom of the pan, and it's safe. But 60 degrees should be maintained. But when it's not maintained, that's when you develop an overgrowth of the bacteria. That's when you get the ailment.
Hepatitis A. What are the signs and symptoms of hepatitis A?
You said jaundice. One is jaundice. They have fever. Sometimes they vomit. And on a protracted time, they have also weakness, joint pains, flu-like symptoms. That's the more common thing that they experience.
So that's the more common manifestation of someone for
For
A.
hepatitis A.
I understand there's also B and C. So
Yes.
can we distinguish between hepatitis B and hepatitis C?
Well,
Doc Bench?
hepatitis B and C are more serious infections than hepatitis A, because hepatitis B and C are contracted in a different way. Hepatitis B is created either sexually transmission or through blood, because it infects the blood. And hepatitis C is also a blood-borne infection. So there's a difference between them and hepatitis A. Hepatitis B, you get it through the blood, either from transfusion of infected blood, even needles or paraphernalia from drug users that are infected, and also from anybody infected in the blood, or sexually transmitted from infected persons through the sexual secretions. And hepatitis C is mainly only the blood.
Okay. So it's more severe, no, so to speak, B and C, because it already involves the blood
And because
transferring of
B and C can cause cirrhosis and cancer, but hepatitis A does not.
Yeah.
It's more, hepatitis is more so an acute infection. In the initial type of infection, that's when it can cause the most damage. But B and C are long-term infections which can eventually lead to chronic or long-term disease of the liver and eventually cancer, especially C.
Okay, thanks. So Dr. Bench, would like to add to that?
As Dr. Benji once said, there is actually prolonged disease process for both B and C, because after 6 months, if you don't develop antibodies to B, it's considered already chronic. So chronic would mean that it will take a while before you develop antibody, just waiting for antibodies to form to say that you're okay. But some people are normally, they usually come not knowing that they do have it, because some are sort of born with it because they had gotten it during the time that they were infected with a mom who has been pregnant and has been having an active infection. So it could be in utero. So when they have been born, might have gotten it as well. So it's not unusual to have patients with no symptoms but coming to you with the same hepatitis B infection.
We'll talk more about that and who's more prone. But first, we have another question, doctors, from Ryan Santos. Hi, Ryan. Good evening. Ryan? Hi. Okay. Maybe we'll talk to him later on. As I mentioned, we'll talk who are more prone. We'll talk about who are more prone. Are men more prone to having liver diseases, or are women more prone? And what are the factors that make men or women more prone to this disease? Dr. Bench, too.
Oh, okay. It's very hard to say who's more prone, because some people can be strong, like females can be stronger than men, and mostly women outlive their husbands. So I think that for fair game, there's no such thing as one is more prone to the other, except for if you're talking about alcohol. I think in our earlier conversation, that the alcohol tolerance for both sexes are quite different. For men, they're allowed more drinks than women in comparison. So if you have two persons drinking, one female and one male, they can't take the same amount. One would be more prone to an ailment or would get more injury from taking too much alcohol. Like the ratio would be like 3 drinks to 1 drink for females.
And sometimes, like we were talking off cam, no,
Yeah.
that they become immune to it. They think that because they don't feel anything, then it's still safe to just keep drinking.
That's right, because there's more tolerance actually after you take too much alcohol over a period of time. So they think that the soberness that they feel even after a few drinks, which never hit them after the first drink or similar to their earlier experience, would mean that their liver is taking it very well and has been excreting it. There are so many weird formulas that people follow when they take alcohol. They would take some liver supplements before this, and they would also take various drugs just to allow it to secrete, even to the point of taking diuretics just for them to pee immediately after, thinking that the alcohol would go with their pee, which is not really true. So that is actually a problem for most of the patients we get to see, because they think that taking too much for a longer period would definitely mean they're stronger or more macho, but actually they're not. They're more prone to getting sick.
Doctors will talk more about how to take care of our liver when MedTalk returns. Did you know that the liver is the only internal organ capable of regeneration? In as little as 25% of the liver mass, it can regenerate to a whole liver. The hepatocytes or liver cells undergo cell division and re-enters the cell cycle, allowing the liver to restore its function as long as blood supply is active. We're back here on MedTalk, still talking about liver diseases. You may call us at 548-4678 if you have any questions for our doctors. Doctors, how is liver disease diagnosed?
Well, liver disease is diagnosed, first of all, there are blood tests. If you suspect a liver disease or you see a person who might be jaundiced or some vague symptoms, like they have weakness, they feel tired, they have a little problem, they have with their appetite, there are blood tests, first of all, that test the liver function, which would show any abnormalities in the function of the liver, whether it's acute or long-term, or if you can use also the ultrasound to see the picture of the liver. But for the function of the liver, it's the blood tests that really tell us if there's a problem.
Okay, doctors, we had Ryan Santos on the line earlier. I think he's back. Hi, Ryan.
Hi, Angel.
Hi, good evening. May question ka for our doctors? Please go ahead.
Yeah, I just have a question kasi I'm a social drinker, no? So I normally stay up late, very frequent. Tapos like after 2 weeks, parang napansin ko medyo yellowish yung eyes ko. Is that inclined to a liver problem?
Okay, thank you. Salamat, Ryan. He's a social drinker and notice na nagyayellow na yung mata niya.
So if it's
After
social
2
drink,
weeks of social drinking,
that's a little bit unusual. Normally it takes longer to have alcohol-related liver ailment. But you might, I just don't know what social to them is. Some people accept as social drinking, but actually, when you ask them how often do they drink every day. Or when they have socials, they get, pag may
Socials are every
birthday
day.
lang. So then, how many birthdays do you go to? Yung pala every day may birthday. So that's a different story altogether. So And when they drink like a fish. Sometimes they drink so much that they're just so stoned because they're looking for that time and that natural high that they can get sleepy, or sometimes their excuse is that pampatulog lang. So that's the other story. So it's very difficult to say if social means like one drink. So as I said earlier, there are 3 drinks limits for men, like 40 grams of alcohol. And I read somewhere that in the UK, I think they allow you 4 drinks out of a week. So 4 times a week you can drink at 40 grams and 3 days sober, meaning you don't take anything at all.
But in Ryan's case, he noticed that his eyes are yellow. What should he do?
Well, he has to seek a consult with his doctor. He is a physician. I'm sure they'll pick it up. A liver function test would be ideal to determine any abnormalities in their liver function test, which is SGPT, SGOT, alkaline phosphatase, and bilirubin. And an ultrasound, like what Dr. Perez said a while ago, that will be appropriate because that will just usually be the basic step to see what's going on. It may not actually be related to the drink. It might be a calculi or a stone in the gallbladder or something else that might have caused the jaundice, not necessarily related to the drink. So there's just so many things to look into because it may not be the actual relation in the first place.
So when, with our callers' concern, we have another caller. We have Ricardo Mergildo. Good evening, Ricardo.
Yes, yes, ma'am. Yes, good evening, ma'am.
Good evening, good evening. Yeah, go ahead with your question for our doctors.
Itatanong ko lang po ba kung may effect yung pag-inom ng glutathione at the same time kumain ng maraming papaya?
Okay.
Sa alin? Sa liver?
Sa
Para
liver,
so glutathione and
liver.
eating
Papaya.
a lot
A lot
of
of papaya.
Tama, Ricardo?
Yes, ma'am, sa skin.
Sige, salamat. Okay, doctors, glutathione and eating a lot of
Glutathione and
papaya,
papaya.
does it affect the liver?
Not necessarily the liver. Although if you eat a lot of papayas like carrots, you can have yellowing of the skin. But it depends on the level of the glutathione. Kung marami siyang ginagamit ng glutathione, if it's not able to detoxify by the liver, o masyadong marami for too much in an amount, it can affect the liver. But do you think it will?
I think,
Is it
the
effective?
glutathione, a lot of patients have asked me that, but I think the answer there would be the glutathione's level actually is a relationship according to the deterioration of your liver function. If it's low, it would mean that you have some liver problem, but it doesn't goes to say that if you take a lot of glutathione, your liver will be okay.
Yes, it's
a
like
diff-
cleansing the liver. I think that's
I think
common
people have that
notion.
Yeah, that's
misconception, and all I know, glutathione's for the skin and all that stuff, but not exactly for. I haven't found any relationship regarding
to
glutathione
help the liver.
and like something to detoxify the liver.
Yes.
It can make your skin beautiful, probably.
Okay, maybe that's the main function of the glutathione.
I just don't know how
not
it will
necessarily.
blend.
Or
Like
if
you
he's
take too
using
much papaya and
glutathione
too
for
much
the skin, if it will
glutathione, will you
affect the
be?
liver? That might be his question.
Yeah,
Yes, so
yeah, orangey in color or light orange.
anything to keep our liver healthy and maybe to engage more in social drinking, I guess, so that when you drink more and you know that your liver is being clean, then you can proceed or go ahead.
But there's a lot of problems with people, they take too much of these things, not knowing exactly what's good and bad for them. They just take their neighbor's advice. They don't go to their doctors for the right advice, basically.
And
I think that's the problem.
Speaking of advice, doctor, we have a Twitter question here. Are supplements, we were talking about supplements, for the liver effective? Should I buy them? So we were talking about cleaning the liver and taking supplements, and
Yeah, like
how
those
beneficial will it be to our liver to take all these supplements, and what kind of supplements should one buy?
Well, the supplements, that's the problem with some of the advertising we get. But they should take a cue from the the end of the commercial that says no therapeutic claim, because that means that it's not really approved for any therapy. As a supplement, most of those are only minimal, if really have a, if ever they have a good effect on the liver, on keeping it healthy. As a supplement means it just supplements or it just adds on to the effect, not necessarily keeping it healthy. If you do something that's against the liver, like taking a lot of alcohol, that won't necessarily prevent the liver from going bad.
Even if you're taking all these supplements.
It doesn't offset the effect of the alcohol in the end. If you take too much of the silymarines, it will not really negate the toxic effect of the alcohol. It still has a burden on your liver. So that's what people think, and it does not protect it at all.
Aside from limiting one's alcohol intake, what other preventive tips can you give
To keep the liver
to
healthy.
keep the liver healthy?
Well, you know, it's not just alcohol that should be kept in moderation. No? There's also what you call fatty liver, and it has something to do with excesses in what you eat. And you know, of course, if there's so many other ailments that also cause fatty liver. Like if you're diabetic, you know, these things should be kept in control. You have good glycemic control, meaning your sugar should be kept normal as possible. And the alcohol, aside from alcohol control, the fat intake or the intake of carbohydrates should also be limited. Especially for people who are already obese, they should go as close to their normal BMI as possible. That's to prevent them from having problems with their liver.
You mentioned food. I just want to touch on one important aspect, that maybe does our urine and our stool have any indication that there's something wrong with our liver? Like the color of the urine or the stool, does it have any indication that there's something wrong?
Well, sometimes if it's dark, then they would say that it's something wrong. But sometimes it has something to do with the degree of hydration you have for the day. If you're just too dry for the day, then obviously the color of your urine will be highly colored, no? But not exactly to the extreme sense that it look like orangey or darker or tea-colored for some. So that's a different story. But usually if they're tea-colored, then there's something wrong with you.
Okay. And if there's something wrong, they shouldn't self-medicate.
No.
They shouldn't ask their neighbor for
No.
what their neighbor is taking.
Go to
They
your
should go
doctor.
You
straight
have
to
to
their
see the
doctor.
doctor.
Go to
Always
your
consult
doctor.
your doctor first before doing or taking anything for it.
Okay. And consulting the doctor, that's what we just did today. Thank you very much, Doc Benj 1 and Doc Benj 2. Thank you
Thank
very
you.
much for your time.
Thanks,
you.
Angel.
Again, we'd like to thank our doctors for enlightening us about our topic tonight. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.